I've never been fitted, so I went and got fitted, and I picked up my clubs last night, and I'm going to the driving range this afternoon.
So did you leave your door locked on purpose?
Clubs. Free clubs.
Please don't take these clubs.
Wow. Well, Grandpappy always said, you know, companies that are willing to go to the ends of the earth for their employees will be able to get them at about 10% of the cost of Americans.
I'll tell you when I get back.
Yeah.
I love our speaker today. I don't think I've ever been more excited to have a speaker. Dr. Christine McCuen is my wife, as most of you know, and she has a great background. She grew up in Lancaster, Pennsylvania. Did not need to graduate high school, went to Villanova. Some of you Carolina fans have probably heard of Villanova. I believe. Yeah. Graduated there, #1 in sciences, not 1%, by the way. #1. Went on to medical school at University of Pennsylvania, where she...
Pittsburgh.
Oh, sorry. Yeah. Interned at UPMC and residency at Carolina. So she did end up there, and that's how she ended up here. And that's an impressive CV for anybody, and obviously she's motivationally gifted individual. But what's most impressive to me about what she does is the passion that she has for all of her clients. And so I took the liberty of calling some of her peers, and this is what they had to say about you. So Dr. McCuen cares tremendously about her patients, is an outstanding cataract surgeon, and one of the best comprehensive ophthalmologists practicing. That's Dr. Craig Griven, who is chair of Wake Forest, and chair of School of Ophthalmology at Wake Forest, and a fellow for American College of Surgeons. Dr. McCuen is one of the most popular doctors in Greensburg. Her patients love her dearly because of how devoted she is to their well-being. I am honored to work alongside of her. That's Dr. Graham Lyles. And Christine loves to eat, and she picks up my poop. That is Shorty, that's our dog. I am honored to introduce to you today my wife, Dr. Christine McCuen.
Thank you, honey. I appreciate that.
You're welcome.
You called Craig Griven?
Yeah, I text him.
See if that's working, Chris.
All right. Yeah,
Is it working?
it's working. It's working. So, doctors are always telling you to do things, right? Eat this, not that. Cut back on that habit that brings you so much pleasure. You know, fork over your copay every year and come see me. And it gets annoying, right? There's so much to do to take care of yourself, and it's hard to stay motivated. Especially because in every family there's usually some great aunt who lived to be 97 even though she chain smoked and drank bourbon every night, right? So why bother? Well, I want to show you some negative consequences of unhealthy activities to help you stay motivated, okay? Because I'm an eye doctor, all of those negative consequences are going to be eye-related. And in order for this to make sense, you need to know a little something about the eyeball. So, I like to think of the eyes like a camera. Just like a camera has a lens, the eyeball has a lens. It's this structure right here. It's behind the iris, the colored portion of the eye. And the cornea, which is this clear windshield over the eye, works with the lens to focus the image onto the back of the eye, the retina. The retina is a thin layer of nerve tissue that captures the image. And it sends that image to the brain through this nerve, the optic nerve. And this is how the eyeball looks when we dilate your eyes and look inside. We can see the head of the optic nerve right here. And here's the optic nerve. This is where it enters the eye. And the blood vessels that feed the retina enter the eye through that optic nerve in a little tunnel. And some of them are little veins we call venules, and some of them are little arteries we call arterioles. But they spread out and they feed the retina. And the center part of the retina right here, without the blood vessels so prominent, is the macula. And that's the most important part of your retina. That controls your central vision, the vision that you use to drive, to read, to recognize faces. And in our office, we can do a scan. We can take a cross-section image of your retina. So this is a cross-section of the macula where there's this little dip in the middle. And we can see in fine detail all these specialized layers of cells. All right. So we're eating breakfast, and it's delicious. And I like bacon as much as the next girl. Why should we limit our cholesterol intake? Well, cardiologists will tell you some things, neurologists will tell you others, but I'm going to tell you what cholesterol can do to your eye health. So cholesterol can build up in plaques in your arteries, right? And if you get a plaque in your carotid arteries, that sometimes a little piece of that plaque can break away and travel downstream and get lodged in some of those structures, like your brain or your eye. And here we have a little cholesterol plaque that has traveled from the carotid artery into the eyeball and blocked this little arteriole. What has happened is that the retina, which relies on this blood vessel, is starting to die. It's gotten white and swollen because it's not getting the oxygen and the nutrients it needs. So this patient is going to have severe vision loss because the macula is affected. There's really not much we can do for this when this happens. So watch your diet. All right, blood pressure. Why take your blood pressure pills? You know, they're a pain, they have side effects. Why bother? It doesn't seem to matter. Well, when your blood pressure is high, it causes turbulent blood flow in the arterioles, the small little arteries inside of your eye. And that turbulent blood flow damages the inner lining of the blood vessels. And that causes those arterioles to become thickened and hardened. And that can cause the underlying veins to be kind of nicked. We call it AV nicking, where the areas where the arterioles cross the veins, this thinner one is an arteriole, this thicker one is a vein. That area where they cross, the thickened arteriole from the blood pressure can cause that vein to be a little bit squeezed. And in some case, that little vein, that little venule can become occluded, which is what's happened over here. So if that vein becomes occluded, it can no longer do its job. And its job is to drain the blood from the retina and feed it back. And the blood gets backed up, you have hemorrhaging, the retina dies in this area, or becomes very swollen. So take care of it. Okay. This child is wearing sunglasses and a hat, which I love. I'm always wearing sunglasses and a hat, as all my neighbors can attest to, whenever I'm walking the dog, sure. And it's important. Obviously, we know about skin cancer, but what about the eyes? UV damage can cause thickening of the conjunctiva. This is called a pingueculum. I've got them, you may have them too. Pretty much when we were kids running around without sunglasses, if we could go back in time, we may not have these. There's this little yellow deposits you might have in the white part of your eye. Sometimes they can become inflamed and red, itchy. Very, very common. You can remove them, but they typically come back, so we leave them alone unless they're causing a problem. Now this is a little more serious. This is called a pterygium. This is when the sun damage causes that thickened tissue to spread over the cornea. So we have not just the conjunctiva, the clear tissue that covers the white part of the eye, but also the cornea is involved here. Again, we can remove those. It does leave a scar. It does often come back, so you're better off just preventing it with sun protection. And finally, just like skin damage from the sun can turn into cancer, same thing with the surface of the eye. You can get cancer, this is squamous cell carcinoma. You can get it on the conjunctiva, you can get it on the cornea. Again, it's treatable, but it's just better to prevent it. You can also get skin cancer on the eyelid. I see a lot of basal cell carcinoma on the eyelid. It's best to spot this when they're small. You get a little bump, you start to lose your lashes. Once they get big, we can still take care of it, but you have to remember, when you go after a skin cancer, you have to take a wide margin to make sure you get it all. So we have to take a big chunk out of the eyelid. It's a larger reconstruction. So better to nip that in the bud early, even better just to wear your sunglasses and your hat. Safety glasses. If you leave here with any one message, it should be wear your safety glasses or your safety goggles, depending on the activity. Please, you would not believe the stuff I see on call. One of those things is chemical burns. If you're power washing or you're using any type of strong detergent, you really need to be wearing goggles. Not just glasses, but goggles to protect your eyes. Acids can really just take off that top layer of the cornea. We can often get that to heal pretty well with intensive medical treatment, but not always. Bases, however, if you have something alkaline hit you in the eyeball, it's a very poor outcome. There's not a whole lot we can do for this. We can try a corneal transplant, but corneal transplants don't take very well in scar tissue, so this patient obviously has a bad outcome. Foreign bodies in the eyeball. I see little flecks of metal like this almost every day when I'm on call for the hospital. Welders, people are grinding things, little pieces of metal fly up and they actually get rusty. They're in there for a couple days and they get rusty. This is my preferred method for removing them. I take a 30-gauge needle and I use the beveled end as kind of a spoon to scoop it out. And then I take a little device like a Dremel and you just, hold it still and you just kind of burr it out. You just use like a little drill bit to get out the rest of the rust ring.
Do that.
People do well. This is a little piece of wood, maybe from doing yard work. If you're doing yard work, you should be wearing safety glasses. I mean, honestly, just wear safety glasses. Weed whackers, by the way. These are, I am doing this here.
I'm not going fishing anymore.
Buster, do you wear your goggles when you fly fishing, bro?
Yeah, are you gonna wear them? You're gonna wear them, right? You're gonna wear them. I will say this, these are the least gory pictures I could find for open globes. Open globes is what we call a ruptured eyeball. We're going to take a patient to the OR because the eyeball has been punctured. This is about, I've seen nail gun injuries. They look way worse than this. Usually the eye is shriveled up like a grape, but I have seen this. I had a patient who got a nail gun injury to the eye. Somebody was shooting a nail gun, it went right through the drywall and hit him. So if you're even just at a construction site, just wear safety goggles. Or glasses. This is a little filament from a weed whacker, but I've seen weed whackers strike up pebbles, all sorts of things rupture the eyeball. Weed whackers are very, very dangerous. And if you see somebody fishing, do not walk behind them when they're casting. You would not believe how many times a fishing.
Anywhere near fishing.
I'm never fishing again.
Yeah. When you have a
Cut the
ruptured
leader, let him
eyeball,
go.
it's not good. You can see here how the iris, the brown part of the eye, is extruding out through the cornea. There's a laceration in the cornea, and now the contents of the eye have come through. If we get to this in time, we may be able to reposit it inside of the eye, but it's never going to look the same. Usually by the time we get there, it's necrotic, and I have to excise it. And then you do your best to sew the eye back together, but obviously, you're not magic. You can only do so much. People tend to have a poor outcome, so please wear your safety goggles. Why should you choose your sexual partners carefully? Well, there's lots of reasons, obviously, but from an eye doctor standpoint, you need to worry about things like this. Infections on the front of the eye. This, we see not uncommonly in teenagers or young adults. This is chlamydia in the eye. This is gonorrhea. We often see this in newborns who pass through the birth canal of an infected mother. I will take that away. I know it's very gross if you're eating breakfast.
We're past that point.
Infections can also affect the back of the eye. This is HIV retinopathy. and see these white areas here in the retina? That's because the HIV virus damages the blood vessels, and so the blood, the oxygen, the nutrients are not getting to the retina the way they should, and these little areas of the retina are dying. Finally, this is herpes simplex in the eye. That's very common. I really shouldn't link this with other sexually transmitted diseases. This is very, very common. Many people have this in your eye. You get this recurrent irritation, redness, pain in the eyeball. It's kind of like a cold sore. It keeps coming back. It's the same virus. And a lot of times people acquired this when they were babies. They had an auntie with a cold sore, gave them a little kiss. But it can affect the eye. We see it very commonly. Oh, and by the way, something that looks a lot like this, herpes in the eye, is shingles. And I didn't do a slide on this, but if you are old enough to get a shingles shot, you should do it. Get your shingles vaccination. Shingles in the eye can be devastating. You would not believe it. Just if you were, I think it's 55 or older and it's covered by your insurance, go ahead and get your vaccination. Contact lenses. People, you need to take care of your contact lenses if you're wearing them. You cannot be using old solution or water. You've got to keep your contact lenses cases clean. You should not be swimming in contacts or even going into a hot tub with contact lenses, because it can have terrible consequences. So the contact lens, even though they're much better than they used to be, they're fairly permeable to oxygen, they do block some amount of oxygen that comes to your cornea. And if you're wearing your contact lenses too long, your cornea is not going to get enough oxygen, and it's going to send out a distress signal saying, hey, I'm dying here, I need more oxygen, deliver more oxygen. So your body's going to respond by making blood vessels that grow onto your cornea, which cornea is not supposed to have blood vessels there. So you can get scarring, a lot of irritation, the vision can be permanently affected. Just wearing your contact lenses too much can really make your eyes feel lousy, and this is why the cornea starts to break down a little bit. We see terrible eye infections from contact lenses sometimes. People lose their eye. This layer right here, that's pus filling the anterior chamber, the front part of the eye. This I see pretty common. It looks a lot like chlamydia. This is giant papillary conjunctivitis. This is when you get a reaction under your eyelids to the protein buildup on the contact lenses. It can be very irritating. If I see it early and I tell patients to clean their contacts better or wear them less, we can nip it in the bud and people do pretty well. Once it gets to this stage, really the only way to clear it up is to keep a patient out of their contact lenses for months and months, maybe even a year. So it's better just to take care of your contact lenses and nip it in the bud. All right, smoking. Obviously, there's lots of reasons not to smoke. One thing you may not know about smoking is that it dramatically increases your risk of vision loss from macular degeneration. Macular degeneration is an epidemic. It's the most tragic thing I see in my practice. Many of you here may have family members who know someone with macular degeneration. It's extremely common, especially after the age of 70, and smoking dramatically increases your risk of vision loss. You can get macular degeneration and lose vision even if you've never smoked, but smoking is definitely something you want to avoid if you're genetically predisposed to macular degeneration. We think of macular degeneration in two forms. This is the dry form. This is the wet form. The dry form, we have these little yellow bumps called drusen. They're built up of waste particles. We're not sure why people get it. We think it's inflammatory. And then as the macula, different layers of the macula start to degenerate, the choroid layer, the vascular layer under the retina, can send blood vessels up into the retina when they're not supposed to be. And those blood vessels can start bleeding and leaking, and that causes vision loss. And the way macular degeneration affects your vision affects your central vision. So initially, things might be a little bit distorted. Straight lines might look curved or crooked. Things might start looking hazy in the center of your vision. But then eventually, you may have no central vision, and you may be unable to read or to drive. So there's another reason not to smoke. We do have some treatments for macular degeneration. Taking special vitamins may slow it down in some people. A lot of patients come in and get shots every 6 weeks. Obviously, that's less than ideal. So again, don't smoke. All right. Diabetes. We know diabetes is an epidemic. Why should you try to avoid developing type 2 diabetes? And if you have diabetes, why should you take care of your blood sugar? Well, there's lots of reasons. but let me show you some ocular reasons. All right, so diabetes damages the inner lining of the blood vessels, and then those blood vessels start bleeding and leaking. So you can see here all these little hemorrhages, and there's these little yellow dots. That's exudate, that's fats and lipids leaking from the blood vessels. And this picture here, this is called a fluorescein angiogram, where we take dye and inject it into your vein, and then start taking pictures inside of your eye as that dye is passing through your vascular system. And all these little spots here that are lighting up, that's where the blood vessels are leaking. All right, so they're leaking. So why does that matter? Well, here's the macula. Here's how it's supposed to look. These very well-defined, very delicate layers. Once you have fluid leaking into your retina, you develop these cystic areas of swelling, and that can cause the retina not to work very well. And we have ways to treat this. We have ways to kind of dry up that retina, but I tell people it's never going to be the same. You know, if you have a carpet and you have a flood in your house, your carpet gets wet and swollen, you can dry it out. You can bring a fan in and dry it out, but it's never going to work as well or look as good as it used to. And it's the same thing with the retina. So you're better off just taking good care of your blood sugar. This is severe diabetic retinopathy. You know, when the blood vessels start really malfunctioning, the retina downstream is no longer getting oxygen and nutrients, and it's dying. It sends out a distress signal: send me more oxygen, grow more blood vessels. But that backfires because the new blood vessels that grow are very fragile, they're very leaky, they're prone to bleeding, and they can start causing a lot of scarring. They fold in on themselves and start scarring. And that scarring can actually pull the retina off the back of the eye. We call that a tractional retinal detachment. We have ways to treat diabetic retinopathy. We sometimes use laser. Sometimes we use injections. Sometimes that's not enough. Sometimes you've got an eyeball filled with blood. You can't reach anything in the back with the laser. Or you have all that scar tissue pulling the retina up. So then you need to go in for surgery. And we do have surgery for diabetic retinopathy. Again, the outcome is usually pretty poor. You're better off taking care of your blood sugar. All right, finally, you see 20/20. You know, you go to the DMV, you take the vision test, you ace it. Why do you need to see an eye doctor? You're good, right? Maybe not. There are some reasons why you should see an eye doctor, even if you don't have any vision problems. Here's one. This is a tumor inside of the eye. It's melanoma. Unfortunately, we do see this. It's very common to look inside of the eye and see what's called a nevus. It's kind of like a freckle or a mole. I'm tracking a lot of nevi in my patients. And I have a few that I'm worried about. If we do see changes that signal it could be melanoma, we either take the eye out or do radiation therapy. Here's another reason to see an eye doctor. This is a retinal tear. These can be asymptomatic, meaning that you might not know you have a retinal tear. Sometimes you'll start seeing some flashing lights, but it could very well be that you have a retinal tear and you don't know it. If we look in and see a retinal tear, we can put laser around it and seal it up. And what that does is it prevents fluid from spreading if the fluid goes through the tear. So if the fluid inside the eye goes through that tear, it gets behind the retina. The retina can kind of bubble off the back of the eye, kind of like wallpaper bubbling off the wall. And then you've got this, you've got a retinal detachment. The only way to fix that is to go to surgery. So you're better off if we catch it early and just can do some laser in the office around it. And finally, this is glaucoma. You can have 20/20 vision right now and not know you have anything wrong, but you may have glaucoma. This is the optic nerve. Here's a healthy optic nerve. See all this nice healthy nerve tissue right here? With time, this nerve could turn into this nerve, where you slowly lose healthy nerve tissue, and you're left out with this what we call cupped out optic nerve. Glaucoma causes vision loss very slowly, very insidiously. You start losing it from the periphery. You don't notice that. Nobody's really paying attention out here what's going on. But once it affects your central vision, it may affect your ability to drive or read. And nerve damage like this is permanent. So, I hope I've motivated you.
Any questions?
If you have any questions, I'd be happy to answer them.
Contacts, I wear soft contacts. There's UV in their protection. How good is that?
It doesn't cover all of your eye, so you're still better off wearing sunglasses. Yeah. Think about your eyelids too. Yeah.
So I have 2 little granddaughters. One loves to wear sunglasses, but we're talking dime store class sunglasses. For a 2.5-year-old, is that healthy, or should there actually be a sure enough pair of sunglasses? I mean, it seems like the cheap ones darken, cause the eye to dilate perhaps more, and allow more bad stuff in maybe.
Look for the sticker, the sticker that says UVA, UVB protection. You do not need to spend a lot of money on sunglasses for them to be good. If there's that sticker, they're usually good. Yes.
I was recently reading where they're able to isolate the gene that's causing certain blindness. Have they isolated the genetic material for macular degeneration?
So we know of several genes that contribute to macular degeneration. There's many genes that can cause macular degeneration. And really, we should be thinking of macular degeneration as a spectrum of diseases that we're all putting under one umbrella category. We know that some people respond better to the vitamins than others, and eventually we'll be able to test your genes and say, you know what, you're going to benefit from that lutein. You should be spending the money on that fancy vitamin. You won't, unfortunately. You need to do X, Y, or Z. There are certain eye disorders like Leber's and amaurosis, where we do know there's one genetic mutation that causes the disorder. We can target that. But right now, macular degeneration and glaucoma, they're polygenetic. There's many genes that can produce us. Yes?
Do you remove terrariums yourself?
I have done it. I don't like doing it because they come back. One of my partners does it. She's a cornea specialist, so she does a lot of trigia. But Howard and I are going to Honduras next month, and I'm going to be doing a lot of trigia there. It's very common in Central America, all that UV exposure. But I don't really like doing trigia because patients aren't happy afterwards. Your eyes feel really irritated. It's kind of a slow recovery. I like cataract surgery, where they're in the recovery room and they're, I see you, it's better. And the next day they're like, I didn't even know I had anything done. So that's what I do.
About LASIX these days. Is that, I've always thought about that, but I'm scared.
So I haven't had LASIK. I'm nearsighted. I'm a little bit nearsighted, which I don't mind. I can take off my glasses and read. When other women my age are reaching for their reading glasses, I can just take mine off and read. So I've never really considered LASIK. You have to be careful with LASIK. You have to understand that, let's say you get yourself in focus for distance, you're still going to need reading glasses. You may or may not be a candidate based on how thick your cornea is. If you're highly nearsighted, you're going to have to thin your cornea a lot in order to correct that nearsightedness, and that can lead to corneal instability. It's important to get a good LASIK surgeon who's going to do an evaluation and potentially turn you down if you're not a good candidate. You have to understand that it may regress with time. You may end up needing glasses or contact lenses down the road. Prescription probably won't be nearly as strong as what you had prior to the surgery, but it won't necessarily guarantee glasses free for distance forever. You'll still need glasses for reading. Kelly, you have a question?
Yeah, is macular genetic? Is there?
Yeah, there's a genetic predisposition to macular degeneration. Absolutely, it can run in families. Although I do diagnose this in some people who have no family history. Yes.
I had LASIK a number of years ago. Does that affect cataract surgery down the road?
Yes. So.
Great.
You and me both, folks.
Well.
Me too.
Yeah, I mean, we can deal with it. So when we do cataract surgery, we take out the cloudy lens and we put in a new lens implant. And if the lens that you were born with is not exactly the right strength for the length of your eye, we can correct that because we can do measurements and we can put in the man-made lens after we take out your cataract. We can put that man-made lens in that's suited for your eye. It's the right strength, the right power for your eye. Problem is, the way we figure out that power is we take measurements of your corneal curvature and the length of your eyeball, and then we put those measurements into calculations. And I typically run 3 different formulas each time I pick out a lens implant. The calculations aren't perfect, so if there was one perfect formula, I would just run that one formula and be done with it. But I'll measure the corneal curvature 3 different ways, and I'll use 3 different formulas, and then you take an educated guess as to which strength lens implant is most likely to give you the best uncorrected visual acuity at distance. LASIK, messes that up just a little bit. It makes the calculations and the formulas less reliable. We do have ways around this now. We started to do something called ORA, where we take measurements in the OR. So after I take out your cataract, I inject some gel into your eye to make it nice and firm, and then I turn off my microscope light and I give you this red light to look at. You focus on that red light, and it takes some extra measurements too. And that is helping me be more accurate when I pick my lens implant for LASIK patients. Usually we get you in the ballpark, you know, but I would never say to any patient, I'm gonna get you 100%, no glasses for distance with this cataract surgery. I'll say, we're gonna try, I think we can get you close. If you do need glasses, they'll be very weak. But that's especially true in LASIK patients.
Oh, and I find that very offensive. I just looked at that and I thought.
Well, she succeeded.
That's
right. She did a residency, all right.
Yeah, I did my residency in Carolina, but my heart is from my undergrad.
Wildcats.
Is there anything that people should know about Flomax?
Well, funny you should ask how we're doing this. So, I put this in just in case we have time. So here's cataract surgery, and you know, cataract surgery, here's what we do. We open up the capsule of the cloudy lens. If you think of a cataract as like an M&M, we open up the candy shell, and we go in and take out the chocolate, okay? Here's an ultrasound probe chopping up the meat of the cataract and sucking it out. Then we put the new lens implant in place. Flomax, or tamsulosin, is a medication commonly prescribed to men with enlarged prostates. And it can make cataract surgery very tricky. See how this iris right here is prolapsing out of the wound while we're doing surgery? Flomax can make the iris muscle tone really go down, so the iris starts flopping around. We call that intraoperative floppy iris syndrome. The pupil gets small too. That makes cataract surgery a lot more challenging and a little riskier. You're at increased risk for complication. I'm doing 2 patients today who are on Flomax. We can handle it. It's difficult and the risk goes up. So if your doctor is thinking of starting you on tamsulosin or Flomax for your prostate, you may say, you know what, maybe I should just talk to my eye doctor first, see how close I am to cataract surgery. Once you start Flomax, stopping it doesn't matter. It permanently changes the muscle tone in your iris. So when I have patients who want Flomax, I don't even tell them to stop. I'm just like, okay, I'll just deal with it. Just keep taking it. And see, these are some ways we can deal with it. I can put in little iris hooks to keep the iris stable during the surgery. I can use this. This is called a Malugin ring. We inject that into the eye and use that to hold the iris back so we can get to the cataract. But it's just easier if you're not on Flomax. So if you're thinking of having cataract surgery and you're thinking of starting Flomax, do the cataract surgery first. Thank you.